Howdy folks. It has been quite a few more weeks than I had originally anticipated for the past few weeks because my parents were visiting from Taiwan and I wanted to spend some quality time with them along with Mushi, the kiddos, and my in-laws. And obviously on top of that, there was work. I got super busy, so I kind of put this thing off a little bit just so I could have some quality time with my family. Now I'm back. Parents, in-laws are all back in Taiwan. And Mushi and the kiddos are in Brentwood or around Nashville, Tennessee. And I'm back in Boston working by myself, lonely. I get to have some time to do some clips again. So here we go. Today, I am going to give an update on some monkeypox stuff. We had originally covered monkeypox about 2 months ago. And I think at this point, there has been a few updates that I think everybody should be aware of to a certain degree. So let's go. Howdy folks, this is Dr. Bao.
Yes.
The goal of this channel is to make it useful for those of you who might be interested in learning more about a doctor's life. You could be a student, a resident, a fellow, an attending, a parent, or someone who simply loves to information overload yourself.
Seriously.
Although I do work and am affiliated with some hospitals and med school, what I say does not represent the opinion of any entity except myself. Please like or dislike, hopefully not dislike, subscribe, comment, share, and press that bell icon.
Great.
All right, as you can see, I'm not driving today. I'm actually in my work office, or one of the work offices. And as I catch some breaks here or there, I'm gonna try to finish this clip. So we did talk about monkeypox about 2 months ago, or more than 2 months ago at this point. And there was a lot of information from that clip that I think is still useful. So I would encourage all of you, if you need to, review that clip for some monkeypox info. This time, we're gonna give a few updates. First of all, compared to the last time when we spoke, the total monkeypox cases in this world have grown from more than 4,300 at the time when we talked last time to more than 65,000 cases at this point, including one death, unfortunately. Out of these more than 65,000 cases on Earth, the US has more than 24,000 cases. A pretty scary fact when you think about it. As of now, all 50 states of the United States have confirmed cases, with California, New York, and Florida being the top 3 states with the most confirmed cases, all in the 4-digit range, meaning thousands. The 3 states that are near and dear to my heart, Massachusetts, Tennessee, and Ohio, all have confirmed monkeypox cases in the 3-digit range, between 200s and 300s. Now, let's go over some of the ways that monkeypox can spread. There are 5 main ways, and we touched upon most of these ways last time when we talked about monkeypox. But I think this is a very important message for everyone to kind of understand in order to protect ourselves and our families. So let's go over the 5 ways. Number 1, monkeypox can spread through direct contact with an infected person's rash, scabs, or bodily fluids. So touching, kissing, and having sex. Can't really imitate that here. But these can all potentially lead to monkeypox infection or spread. Number 2, monkeypox can spread through touching objects such as clothing, bedding, towels, or other items that have been used by someone with monkeypox. Number 3, monkeypox can spread through respiratory secretions, meaning if you sneeze on someone or if you cough on someone, and if you have monkeypox, there is the potential for you to spread that infection. Number 4, monkeypox can spread potentially from an infected animal, either by us being scratched or bitten by the infected animal, or by preparing or eating meat or using products from an infected animal. Number 5, and the final way, as far as we are aware of right now, a pregnant woman can potentially spread monkeypox to her fetus or baby through the placenta. Now, we have gone over signs and symptoms last time, and these symptoms remain largely unchanged. So I don't want to spend too much time going over the signs and symptoms over here. However, I will emphasize the hallmark symptom of a rash, and that if you happen to have any questions about any rash that you might have, or one of your friends or family might have, it is always the right thing to check in with your doctor, or have your family or friend check in with his or her doctor. But before you check in with your doctor, avoid close contact, including sex or being intimate with someone. I know, it's hard. I mean, no sex. Come on. But do the right thing, my friends. Avoid close contact until you have been checked out by a healthcare provider. Now, let's talk about testing. As of right now, testing is only recommended if you have a rash that is consistent with monkeypox. Meaning, or in other words, only a healthcare provider can order a monkeypox test for you. And therefore, anyone other than a healthcare provider telling you that he or she can get you a free test is likely selling you a scam. And unfortunately, this does happen and has happened to some of our patients. I'm not really sure what these folks who are selling these scams are thinking, but they do happen, unfortunately. So be careful out there. Now, for those of you without insurance or that you are concerned with budgeting or money, testing done at a public health department is generally free versus testing ordered by your primary care physician at a lab or a private place generally costs some money, depending on your insurance plans. So FYI, if you happen to have monkeypox, which I hope not, but if you happen to have monkeypox, you should stay isolated until your symptoms are all gone and your rash has healed, meaning all scabs have fallen off and a fresh layer of skin has formed. Please do take these recommendations seriously because they are not only just for you, but also for your family and your community, which you should care about, but whether you actually care about or not, I guess that's not up to me, and that's a totally different discussion. Now, big topic, vaccination. Monkeypox vaccines are currently available, and there are 2 offered in the US. The names are not important, but there are 2 available and are offered in the US. You may want to get vaccinated if you have been identified as a close contact of someone with monkeypox, or if you participate in what we commonly call as high-risk behaviors. For examples, group sex, orgy, paid sex, sex with strangers, and potentially other forms. All of which sound super exciting and maybe fun. Maybe, not sure. But are actually really dangerous for your health. At this current moment, we do not encourage vaccination against monkeypox for the general public or everyone who is sexually active, which is probably you, or maybe not, who knows. Now, I won't lie. Monkeypox vaccine supplies are limited, which means if you get it when you actually don't need it, that potentially means those who actually need it might not be able to get it. So let's stay considerate, all of us, myself included, and you, and you, and you, all of you sexually active people, be considerate. If you don't know whether you should get vaccinated or not, talk to your doctor. But keep in mind, getting vaccinated within 4 days after exposure to someone with monkeypox provides the best chance to prevent the disease or make it less severe. Lastly, besides getting vaccinated, there are other things that we can all do to protect ourselves or to minimize our chance of getting monkeypox, such as safe sex. I know, that sounds very boring to many of us who like safe sex. But safe sex is good for you, really good for you. Also, don't go around and touch people's rashes. I know what you think, but there are actually people out there who just go around and touch people's rashes. So be smart and be safe, or be normal. If you have questions about medicine in general or how to become a doctor, leave a comment. Eventually I will get back to you. For now, best of luck to everyone.